Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Doctors and nurses and medical technicians at Upstate repair the physical wounds of patients who are victims of street violence. With me to explain the role of Upstate's Violence Education Prevention Outreach Program, or VPOP, is trauma social worker Tafara Timmons. Welcome to the Informed Patient, Mrs. Timmons.
Thank you for having me, Amber.
Upstate University Hospital is designated as a Level 1 trauma center, which means it has expertise in caring for trauma patients and people who suffer gunshot wounds or stabbings or assaults. They often receive treatment at Upstate, so it makes sense that the hospital would have a violence prevention program. Can you tell us how this program began, Mrs. Timmons?
Well, this program began in 2015. Upstate wanted to create a hospital-based violence intervention program to reduce the rate of recidivism by addressing social determinants of health specific to individuals and families affected by community violence. So VPOP was developed out of that desire to create an HFIP program.
So the hope was that they could try to end some of this violence, or at least the repeat violence.
Yes, by creating a program that is needed in a Level 1 trauma center to help deal with the social determinants of health that accompany these types of injuries.
So can you tell us about your role as a trauma social worker?
As the trauma social worker facilitating the VPOP program, I respond to traumas that present in the ED, either assaults or gunshot wounds or stab wound injuries. At that time, if there is identification that is needed, if there are families that present, I can meet with those families. I can help identify the individual within the EDs. So just kind of dealing with the presentation and the social work aspect of that presentation to the ED. Also, as the trauma social worker for the VPOP program, I follow the patients throughout their hospital stay. So I'm able to provide them with community resources, emotional support, and kind of meet their needs at the bedside throughout their acute stay here at the hospital.
So it sounds like you're really focused on the patients, but you also may interact with their family members. Is that right?
Yes, oftentimes when individuals present to the ED after these traumatic injuries, there will be family members that present to the ED wanting information, trying to find out how their loved one is doing. So that's a part of my role as well, is to provide emotional support to them and also help them navigate the next few moments.
So how do you, as the social worker, prepare yourself to help people who are likely having one of the worst days of their lives?
There really isn't a way to prepare per se because it's so different. Each trauma can be different, each family, each patient. What I did and the approach that I took was to educate myself at a macro level and make sure that I was aware of the systems and policies that present themselves in these situations. In addition to that, I became a certified trauma professional to help understand how trauma plays a role in these situations, not just trauma from the injury, but other traumas that may have happened throughout the lifespan. So just educated myself on trauma-informed care because, again, there is no real way to prepare when it's a case by case and every family and every patient is so different.
Do you find that the patients are surprised that there is someone who is focusing on violence prevention?
I don't think that they're surprised at the fact that someone's presenting at the bedside and having these conversations with them. I think they are more surprised at the level of care that they're getting because I'm able to be at the bedside sometimes on a daily basis if they need it, sometimes multiple times throughout the day, providing emotional support, helping them navigate the emotions that arise when you're injured in this manner. So I think that is kind of like, maybe we won't say surprised, but there's a lot of gratitude when they have this level of support. And I think they're just kind of thankful.
This is Upstate's HealthLink on Air with your host, Amber Smith. I'm talking with trauma social worker Tafara Timmons from Upstate University Hospital. How often are people receptive to making changes in their lives?
People are receptive to making change in their lives in these moments because it's at what we call this teachable time, or this is a teachable moment where they are injured, they're hurt, sometimes confused, and just wondering what they can do to better outcomes. So they're receptive, more receptive during those teachable moments. And also with again, the level of support that they receive, I think it makes it easier to navigate during the hospital stay and post-discharge.
What are the benefits for someone engaging in VPOP? What services might the person receive?
Well, within or during their hospital stay, they receive emotional support, psychoeducation, where we talk about the effects of trauma. They receive social work, services, community resources, things of that nature. In addition to that, we have kind of restructured the program that in a way that allows us to work closer with community partners, and with that, those relationships that we're building, the patients will receive post-discharge outreach and supportive care coordination. So that could include navigating health systems, assessing primary care needs, and connecting with providers, employment resources, housing resources, education, mental health, most importantly, and also substance use, also very important. If there's a need for those resources between myself and our community partners, we make sure that they are connected. And if they need additional support for ongoing change, that they have someone there available.
So you work with them from the time they're in the hospital until discharge, but you discharge them to another social worker in the community?
There are community resources that we're partnering with for that long-term case management piece. So not always specifically a social worker. The program decides, what type of systems they need connections to. And from there, if it's not a social worker, for some other case manager, then, they receive that support. I stay connected to make sure that the handoff is warm and that it goes through and that the connection is made. And once that is the case, then I'm able to kind of take a step back and allow our community partners to continue their work.
Do you see VPOP making a difference?
I do see VPOP making a difference. I believe it already has made a difference because of the increased level of care, the way that we've restructured the program, and the amount of time that I'm able to spend with the patients during their hospital stay. So they're receiving a lot of support during the stay, post discharge, and not only just having me there. Like I said, a few times, I'm also able to be there multiple times throughout the day if needed. So it makes a difference because I'm able to build a relationship with that individual, sit down with them, and really make sure that we're filling any gaps in care or social needs to help them move forward.
Well, Mrs. Timmons, I appreciate you making time for this interview.
Thank you so much for having me. I appreciate it.
My guest has been trauma social worker Tafara Timmons from Upstate's Violence Education Prevention Outreach Program. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/inform. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.